We will now demonstrate the use of the flow control tubing. The nurse will wash her hands and dry them, and then assemble supplies on a clean, dry surface. The supplies include the medication or hydration bag, which should be removed from the refrigerator at least 60 minutes prior to dose time, the IV rate-controlled tubing, saline flushes if applicable and heparin flushes if applicable, alcohol swabs, and tape. The nurse will read the medication label on the bag to confirm that it is the correct patient, medication, and expiration date. The protective blue cover is removed from the spike port on the bag, being careful not to touch the port itself. Next, the protective cover on the tubing spike is removed, and without touching the spike itself, it is inserted into the port on the medication hydration bag using a twisting motion to secure. Once it is secure, the bag is hung on the IV pole, and the drip chamber is squeezed until it's approximately 1/3 full. Next, we will prime the tubing. This is done by turning the dial to the open position, matching the arrow with the word open. The tubing is full when a drop of fluid appears from under the protective cap at the end of the tubing. Adjust the dial to the off position once the tubing is filled. It is now time to attach the tubing to the venous access device. Cleanse the threaded end of the injection cap with 3 alcohol swabs, wiping for 1 full minute. Attach a saline flush to the needleless injection cap and insert the contents of the flush using a push-pause motion, stopping at the last 1/2 cc of solution. Next, remove the protective cap on the end of the IV tubing. Screw the IV tubing directly onto the injection cap. And tape the connection. Make sure all clamps are open on the IV access device and on the tubing. Next, you will turn the dial to the selected rate. For example, if our rate is 200 per hour, you will match the arrow with the 200 milliliter per hour rate. This should start the infusion at the prescribed rate at 200 milliliters per hour. When the infusion is complete, turn the dial to the off position. Remove the tape from the tubing catheter junction and unscrew the IV tubing from the injection cap. If the tubing is to be reused for the next dose, place a red cap on the end of the tubing. Otherwise, the tubing may be discarded. Using 3 new alcohol swabs, cleanse the needleless cap for 1 full minute. Remove the cap from the saline flush. Screw the flush directly onto the needleless cap. Insert the contents of the flush into the catheter using a push-pause technique and stopping at the last 1/2 cc of fluid. If it is an open-end catheter, repeat the procedure with the heparin flush using the push-pause motion and stopping at the last 1/2 cc of flush solution. This completes the procedure for the rate-controlled device.